Is capsaicin good for IBS? Let's talk about a common question. Is capsaicin good for people with irritable bowel syndrome? Capsaicin is the compound that gives chili peppers their heat. It activates a receptor in the gut called TRPV1. This receptor is involved in sensing pain and irritation. For individuals with sensitive stomachs, especially those diagnosed with irritable bowel syndrome or colitis, capsaicin can actually trigger symptoms. When someone with irritable bowel syndrome consumes spicy foods containing capsaicin, they often feel increased abdominal pain, a burning sensation, and sometimes discomfort in the rectal area. This occurs because the gut in irritable bowel syndrome is more sensitive to irritants, and capsaicin stimulates the pain pathways in the digestive tract. Research indicates that short-term exposure to capsaicin usually worsens symptoms like pain and burning in people with irritable bowel syndrome. This is because the TRPV1 receptors are more active in the guts of those with irritable bowel syndrome and other conditions involving gut sensitivity. In practical terms, this means that for someone with a sensitive stomach, eating spicy foods with capsaicin is likely to lead to discomfort. Interestingly, there is some evidence suggesting that long-term exposure to capsaicin might help the gut become less sensitive to pain over time. This could happen because the body may adjust to the irritation by changing how the TRPV1 receptors function. However, this effect is not strong enough to recommend capsaicin as a treatment for irritable bowel syndrome, especially for those with sensitive stomachs or colitis. From the viewpoint of someone managing irritable bowel syndrome or colitis, capsaicin is generally not seen as beneficial for digestive health. Most people with these conditions find that steering clear of spicy foods helps reduce their symptoms. If you have irritable bowel syndrome or colitis and notice that spicy foods worsen your symptoms, it is usually best to limit or avoid foods containing capsaicin. For practical advice, if you are managing irritable bowel syndrome or colitis and want to try spicy foods, it may be wise to start with very small amounts to see how your body reacts. However, many individuals with sensitive stomachs find that avoiding capsaicin is the safest choice.